Hi, I am Dr. Mangesh Kamath. I am a senior consultant medical oncologist practicing at Healius Cancer Hematology Clinics, Bangalore. Today, the topic of discussion is on bone cancer. As you would understand, bone cancer is the cancer of the skeletal system in our body. Most commonly, bone cancer can occur in the long bones, which are the bones of the legs or the bones of the arms. So basically, bone cancers have different histopathological varieties, or we call them as subtypes of bone cancer. And all of these histopathological subtypes behave differently, their treatment is different, and in many cases, even the curability is different depending on the subtypes. Apart from the fact that they are very commonly seen in the long bones, that is the bones of the upper limb and the bones of the lower limb, they can also be seen in the axial skeleton, that is the bones of the ribs, the bones of the vertebral bodies, or the what we call as the backbone, and bones of the hips. The major difference is that in the case of bones of the upper limbs and the lower limbs, sometimes we can remove the affected bone, replace it with an artificial bone or a metallic bone, which may not be possible in the bones of the backbone, because if you do something like that, you may be paralyzed. So the way to manage the cancers of the bones is by either doing a surgery and removing the affected bone, or by giving radiation to the non-removable bone areas such as the backbone and the bones of the ribs. Apart from that, you can make sure that you consolidate the effect of the surgery and the radiation by giving systemic therapy. Most likely chemotherapy is given. The reason why chemotherapy is given is once you remove the bones, which are highly vascular structures which are supplied by blood vessels, there is a possibility that the tumor cells can spread to other bones which can occur due to surgery or even without surgery, and also spread to certain organs such as the lungs. And once these tumors they spread to other organs, they are virtually incurable in most instances. If you would like to know about specific subtypes of bone tumors, please mention, and I would definitely make videos on the specific subtypes of bone tumors. The most common bone tumors that are known are osteosarcoma, Ewing's sarcoma of the bone, chondrosarcoma, and many other subtypes which may be too many to enumerate in this video, but we can definitely make individual videos on each if required. There is also a very commonly encountered tumor of the bone called as giant cell tumor of the bone, which is much more commonly seen than the cancers of the bones, and I will make a separate video on that because it has to be treated very differently, and the curability of giant cell tumor of the bone is also different and a lot better. So in general, bone tumors present with the early stage or in a metastatic stage or in a stage where they have spread to other organs. The ones that have not spread to other organs can be highly curable dependent on the types of the bone tumors, and when managed by a competent, skillful and experienced multidisciplinary team, the cure rates are very high for such bone tumors. Even if there are bone tumors in the limbs, today we have a lot of strategies which are surgically comprehensive called as the limb salvage surgical procedures, by which the tumor can be removed. At the same time, the functionality of the individual may not be compromised much. In the older days, removal of the bone tumors would usually mean an amputation, which would handicap an individual. But today, due to the availability of limb salvage surgical approach, we are able to preserve the limbs of many patients. At the same time, also make sure that they are cured of the cancer. Is there any particular age group in which these bone tumors can occur? Well, the range is wide. You can have children with bone tumors and elderly individuals, old age individuals also having bone tumors. In general, the commonest bone tumors or bone cancers are seen in the younger age. I see a lot of children with osteosarcoma and Ewing sarcoma. Adolescents and young adults also can have osteosarcoma and Ewing sarcoma. Middle-aged patients most commonly have chondrosarcoma. So, if you have any questions about bone cancers, please ask them in the comment box, and I will definitely be happy to create many such videos to educate you all. Thank you.